Oklahoma Certified Nurse Aide Online Test Prep. Question 1. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A. Keep the environment bright and noisy. Option B. Use a calm, gentle approach and low lighting. Option C. Give the client a sleeping pill. Option D. Ignore the agitation until it passes. The correct answer is option B. Use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 2. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: Option A. Document this as normal. Option B. Report it to the nurse immediately. Option C. Reposition the sensor and wait. Option D. Increase the client's oxygen. The correct answer is option B. Report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 3. What is the most important action a nurse aide can take to prevent the spread of infection? Option A. Wearing gloves at all times. Option B. Performing hand hygiene. Option C. Wearing a mask. Option D. Isolating all clients. The correct answer is option B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 4. The chain of infection includes: Option A. Pathogen, host, transmission route. Option B. Air, water, food. Option C. Bacteria, viruses, fungi. Option D. Skin, blood, mucous membranes. The correct answer is option A. Pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example: hand hygiene breaks the mode of transmission. Question 5. The nurse aide should document care. Option A. At the end of the shift. Option B. As soon as it is completed. Option C. Before providing care. Option D. Only if the client's condition changes. The correct answer is option B. As soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 6. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 7. The nurse aide should report which finding as a possible sign of abuse? Option A. Bruises at different stages of healing. Option B. Bruises on the shins. Option C. A client who is hard of hearing. Option D. A client with memory loss. The correct answer is option A. Bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 8. A client with a pulse of 112 beats per minute is experiencing: Option A. Normal heart rate. Option B. Bradycardia. Option C. Tachycardia. Option D. Arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 9. Standard precautions apply to which bodily fluids? Option A, blood and blood products only. Option B, all body fluids, secretions, and excretions. Option C, only visible blood. Option D, only if the client is diagnosed with an infection. The correct answer is option B, all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 10. Systolic blood pressure represents option A, the pressure when the heart is at rest. Option B, the pressure in arteries when the heart contracts. Option C, the pressure in the veins. Option D, the pressure in the capillaries. The correct answer is option B, the pressure in arteries when the heart contracts. Systolic pressure is the maximum pressure during left ventricular contraction, systole. Diastolic pressure, option A, is when the heart rests. Venous and capillary pressures are not part of standard blood pressure measurement. The systolic is the first sound heard. Question 11. When a client dies, the nurse aide should: option A, leave the room immediately. Option B, provide post-mortem care. Option C, call the family. Option D, remove all personal belongings. The correct answer is option B, provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 12. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A, to 100 mmHg. Option B, to 150 mmHg. Option C, to 180 mmHg. Option D, 30 mmHg above the estimated systolic pressure. The correct answer is option D, 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 13. When applying a gait belt, the nurse aide should place it: option A, around the client's chest. Option B, around the client's waist, over clothing. Option C, around the client's hips, under clothing. Option D, around the client's neck. The correct answer is option B, around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 14. The nurse aide should speak to a client who is hearing impaired by: option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 15. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 16. What is considered a normal blood pressure for an adult? Option A, 90/60ths mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60ths is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 17. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 18. Which statement demonstrates therapeutic communication? Option A, you should not feel that way. Option B, everything will be fine. Option C, tell me more about what happened. Option D, I know exactly how you feel. The correct answer is option C, tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 19. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B, provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 20. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B, report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 21. Which task is outside the nurse aide's scope of practice? Option A, applying a gait belt. Option B, recording output. Option C, changing a sterile dressing. Option D, offering a bedpan. The correct answer is option C, changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 22. What does the abbreviation ADL mean? Option A, ad lib. Option B, as doctor likes. Option C, activities of daily living. Option D, after daylight. The correct answer is option C, activities of daily living. ADL stands for activities of daily living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aide practice. The other options are incorrect medical abbreviations. Question 23. Which approach is best for a client with dementia who becomes agitated during personal care? Option A, use a firm tone to assert authority. Option B, provide simple explanations and allow choices when possible. Option C, complete care quickly regardless of the client's response. Option D, skip the care altogether. The correct answer is option B, provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example, would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 24. A client with dementia is attempting to leave the facility. The nurse aide should: Option A, allow the client to leave. Option B, redirect the client to a safe activity. Option C, physically restrain the client. Option D, call security to escort the client out. The correct answer is option B. Redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 25. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B. Perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction.